How is Afib diagnosed? In this video, we are going to talk about how Afib is diagnosed and what medical tests are commonly done to evaluate patients that have or may have Afib. Diagnosing Afib can be a challenge because it can come and go, which is called paroxysmal Afib. Also, for many people, they do not have symptoms when in Afib, so they are not aware that they have it. Two common scenarios on opposite ends of the spectrum would be A patient is noted to be in Afib during a routine health evaluation and had no idea because they never had symptoms. Or alternatively, a patient with intermittent symptoms of fast heart rate or palpitations, but the symptoms are too brief or intermittent to be evaluated by a healthcare professional. The diagnosis of Afib is based on the history, physical examination, and most commonly an ECG, also called an EKG or electrocardiogram. An ECG is a recording of the electrical signals of the heart, and the typical features of Afib on an ECG are an absence of P waves and an irregular rhythm that is often fast. Afib can also be diagnosed by other ways of measuring the electrical signals of the heart, such as ambulatory rhythm monitoring. For example, Holter monitors, event and implanted loop recorders, and some pacemakers and defibrillators can also diagnose Afib. Besides an ECG and rhythm monitoring, other testing that may help assess someone with Afib are lab blood testing to include a blood count, electrolytes, kidney, liver, and thyroid function tests. A chest x-ray if lung disease or heart failure is suspected. A transthoracic echocardiogram or ultrasound of the heart to evaluate the heart structure, including the size of the atria, the pressures in the heart, and to detect any heart valve issues. A transesophageal echocardiogram, or TEE, which is when the echo imaging device is placed in the esophagus or food tube while the patient is typically sedated. A TEE is often the most effective way to assess for blood clots in the heart. Sometimes exercise testing is used to assess heart rate control. Afib can be challenging to diagnose, and the evaluation can involve multiple tests. Good communication between you and your doctor is essential to make sure you understand how your Afib is being assessed. This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Thanks for watching, and if you want to learn more about living a long, healthy life you love, click the link below to learn more about how we help people increase their health span. And if you like this video, hit the like button below, share it with your friends, and be sure to hit the bell and subscribe.